At 4:30, some new research shows the devastating impact the coronavirus can have on pregnant women. A study shows the virus can invade and destroy the placenta and lead to stillbirths in infected women. There were researchers in 12 countries, including the U.S., and it all involved unvaccinated women. Here to talk to us more about what this new research is showing is Dr. Christopher Morosky from the Department of Obstetrics and Gynecology at UConn Health. Doctor, thank you so much for being with us.
Thank you for having me.
So obviously, this is a pretty frightening and alarming study. I imagine it got a lot of people's attention. What did researchers exactly find here?
So this study gives us more information about what we've known since the beginning of the pandemic when we started collecting data, that for women who become pregnant with COVID-19 in their pregnancy, they have increased complications for themselves compared to women who aren't pregnant. But there's also increased risk to their pregnancies. And one of those things that we see is that there's an increased risk of stillbirth. What this study shows is that the way that that's probably happening is that in certain pregnancies, the placenta becomes infected and then the placenta becomes destroyed, and that this is the cause of the stillbirth.
Is there any women who are more at risk than others due to whether they have certain underlying conditions?
There's certain medical conditions that patients can have that put them at risk for stillbirth. For example, chronic hypertension, diabetes, certain other medical conditions that can be more severe. And so in those settings, when patients become also infected with COVID-19, we have to be a lot more cautious in our follow-up and our testing and having concern for stillbirth.
This study mentioned that it was among unvaccinated women. I imagine that there are maybe some steps to prevent this in terms of the placenta and stillbirths. Does getting vaccinated help?
The study didn't specifically address the vaccination protected patients against this, but the information that we have so far, we do know that COVID-19 vaccine, the initial series, the boosters, are safe in pregnancy. We know that that does reduce the risk that patients themselves will have medical complications. And we do believe that the vaccines prevent against the pregnancy outcome complications, such as stillbirth.
For people who are watching this right now and a little bit scared, because like I said earlier, it is definitely alarming to hear this, especially if you're pregnant or looking to get pregnant. What are you telling your patients? What's the biggest takeaway here?
The biggest takeaway would be that the American College of Obstetricians and Gynecologists, the Society for Maternal Fetal Medicine, and the CDC all recommend that patients who are thinking of becoming pregnant or those who are pregnant get the COVID-19 vaccine. And if you're eligible, get the booster shot. That's going to be the best thing to protect you and to protect your unborn child. And we believe that that immunity is passed on through the placenta and into the breast milk for those who are going to breastfeed. And then that will protect your newborn baby.
All right, a lot of good information. Dr. Christopher Morosky from UConn Health. We appreciate you taking some time to be with us. Thank you.
Thank you.